Welcome to session 5 today. We're going to focus on health and hospital care. And kind of a fitting subject because when we usually introduce our chaplain program, we talk relative to employees being served and introducing them to the concept of chaplaincy. And it's not lost on us that most of the time when people hear those two words, either corporate chaplain or community chaplain, many times it's the first time they've ever heard those kind of words put together in a sentence. Most people are familiar with military chaplains or hospital chaplains. And so we're going to talk about hospital ministry today, not specific about being a hospital chaplain, but about how all of us can go in and make that hospital visit, know the things to say and the things not to say. Now, if many of you are like me, if you are in the hospital and the hospital chaplain comes by to see you, how many of you are wondering, just how sick am I? And you start wondering, what exactly is happening here? And so we can get frightened and we can all go through a variety of emotions when we're in the hospital. But those emotions that we feel, if we were to take a poll today and have the opportunity to go around the room, and for those of you watching on videotape in your small group, if you had the opportunity to just hit the pause button for just a moment and hear the stories that we all would share of past hospital experiences, we would all, I'm sure, be able to share the wide range of emotion, the fear, sometimes the uncertainty, the confusion that comes with just simply not feeling well. But think about that wide range of emotion that if you've been a patient in a hospital setting, or if you've had a family member as a patient, the emotions that you grapple with, and think about that as an entryway, almost an invitation, if you will, for us to go in and serve, again, by permission, people who are going through health and hospital ministry. And so today what we want to talk about is just that, how hospital ministry goes about, what we're wanting to focus on, and the things that we want to be able to do and not do, the things that we should say and not say as we go in and care for people in hospital ministry. Now, remember, our mission statement. Our mission, page 62 in your book is where we're going to be focusing today, page 62. Our mission is to build caring relationships with the hope of gaining permission. And circle the word permission in today's mission statement on page 62. Gaining permission to share the life-changing good news of Jesus Christ in a non-threatening manner. In hospital and healthcare ministry, permission is absolutely central. And you're going to see as we unfold how to go in and make that hospital visit, how we want to go about gaining permission to even be there in the first place, to show up and make that hospital visit, and then how we want to go about gaining permission through each step of the process in that hospital visit and in that healthcare ministry. Page 63, you'll remember by way of review, as we look back on session 4, we talked about evangelism. And we talked about that sharing of the life-changing good news of Jesus Christ. And I will tell you that in looking back at session 4 and thinking about those concepts that we focused on in session 4 on sharing the good news, there is a wonderful bridge between caring for people in hospital settings and building that bridge to the relationship being long enough and strong enough that we gain that permission to share the life-changing good news of Jesus Christ. And so begin thinking even right now as you think about making that hospital visit, or as you think about reaching out to that patient who may be in the nursing home, be thinking about how soft, how open they may be to hearing that life-changing message. Because when we bring that wide range of emotion that we were talking about, that anxiety, that fear, that confusion, there's no greater antidote to the confusion, the uncertainty, and the fear than the peace that can be ours found in a relationship with Jesus Christ. And so we want to think about how those two things kind of interconnect. Our bridge for today, page 63, you find our bridge. It's focused today on how to care for those in our community who are dealing with health-related concerns. And listen to this, how permission, confidentiality, care, and evangelism all apply in hospital, nursing home, and assisted living center environments. Now that is a mouthful. We're going to unpack exactly how we go about building those bridges and working in and through hospital ministry to impact the lives of people around us. Now, why is it so important? Take a look at a statistic found on page 63. and it will give you some window into the big, wide opportunity that we have for hospital ministry. 438,593 people are admitted to hospitals every day in the United States of America. 438,000. And when we see that number, it's almost mind-boggling to think that that number of people may be going into the hospital. Now, the great news is they'll be there for a day or two. Now, not quite as long as they used to be when they would go in the hospital. People would be in the hospital 5, 6, 7 days, and in duration, the stay is much shorter, but 438,000 people going into the hospital, and we have the opportunity to go in, care for them, and help them through those kind of issues. A couple of more stats I'll share with you. Page 62, 63, 1.4 million people are currently in nursing homes. You take a look at hospice facilities, 38% of all deaths take place in a hospice facility. And so when you begin to look at those statistics, what we really are pointing toward in the statistical analysis there is just that there is a wide open opportunity. There is a lot of need that exists for us to be able to step in and minister to people at that point where they're in crisis. Because remember our ministry formula. We've been talking about time plus talk plus transparency plus the trial. And there's no greater trial than going through a hospital stay. The question often comes up, if you're going through like a tonsillectomy surgery. I've got a daughter who now is 14. She went through that tonsillectomy surgery when she was about 16 months old. And when we hear the tonsillectomy surgery, we think, what, minor surgery? And realize, I think we may have even said this before, a minor surgery, the definition of a minor surgery is a surgery that they're doing on someone else. All right? And so anybody going through that surgery, it's a trial. It is a crisis moment in their lives. And so we want to be ready, willing, and able to step in and minister in that kind of situation. Page 63, we ask this big question. Why is healthcare ministry important? And there are so many different ways that we could provide an answer to that question, but I want to focus on a scriptural answer to that question. Why is healthcare ministry important? I want you to take a look at a passage of Scripture with me. This passage is listed on page 63 in your workbooks. It comes from the Gospel of Matthew in chapter 25, verse 34 through 40. And Jesus telling this story here, he says this, "Then the king will say to those on his right, 'Come, you who are blessed by my Father, take your inheritance, the kingdom prepared for you since the creation of the world. For I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was a stranger, and you invited me in. I needed clothes, and you clothed me.'" Underline this next sentence. "I was sick, and you looked after me. I was in prison, and you came to visit me." And then listen to what happens next. Jesus tells this story, and he says, "Then the righteous will answer him, 'Lord, when? When did we see you hungry and feed you, or thirsty and give you something to drink? When did we see you a stranger and invite you in, or needing clothes and clothe you? When did we see you sick?'" Underline that phrase. "When did we see you sick or in prison and go to visit you?" And listen to Jesus' reply and how he really spells this out. He says, "The king will reply, 'I tell you the truth, whatever you did for one of the least of these my brothers, you did for me.'" So why is healthcare ministry so important? Because when we serve people at that point of crisis, Jesus says that when we are visiting those who are sick, we're visiting Him. And so we're serving that person in need, but we're serving God when we serve that person who's sick. So think about that just a minute, and think about healthcare ministry as an oasis of opportunity. It's an oasis of opportunity to serve the person in need, but it's an oasis of opportunity to serve Almighty God, the Creator of the universe Himself. You know, it is all too easy to get really way too busy in life. And if you've been involved for any length of time trying to serve the needs of others, you will understand and realize very quickly that hospital ministry and hospital visits, they don't schedule themselves. And so they will come at inconvenient moments in your schedule. They will come at that moment in time when you're supposed to be in a class like this. Or they'll come at that moment in time when you have 14 different things on your agenda and on your schedule. And it's real easy when that phone call comes or that ministry situation just rises right up in front of you to look at it and say, oh, I don't have time for this. It's an interruption in my schedule. It's inconvenient to have to drive all the way across town to make that hospital visit and all the way back. And then there's no guarantee that I'm even going to get to see the person because they may be down at radiology or they may be having some test done or who knows what's going on. And what I want to encourage you is to take that thought process, the thought process where we might view a hospital ministry visit as an interruption to our schedule, and view it as an opportunity to serve the person in need, but a bigger opportunity to serve God, who has called you and gifted you and given you what is an opportunity to intervene right at the point of crisis and the point of need. And so our motivation is just that. It's looking at hospital ministry from the motivation of we're here to serve God and we're here to serve the person in need. We're looking at it as an oasis of opportunity rather than something to dread. It will change your perspective and I believe allow God to bless what it is you want to do, because the Scripture says here, I was sick and you looked after me. I was in prison and you came to visit me, and that's what we want to be all about. So let's take a look. Overview of medical ministry very quickly. Page 63 into page 64. I want to give you 3 concepts, and just to really tuck into your heads and into your minds and into your hearts of what it is that we're wanting to accomplish. And you find these fleshed out on page 63 to 64. But healthcare ministry is a ministry of several things. Number 1, it's a ministry of presence. Number 2, it's a ministry of prayer. And number 3, it's a ministry of permission. We will unpack that as we go, but think about the ministry of presence. Think about what a strong message it sends when you will take the time out of that busy day that we were talking about. You'll get in your car and you'll drive that 45 minutes over to the hospital, and you'll walk in and you'll invest time showing a ministry of presence, being able to care for people, taking the time to say, hey, let me lift you up in prayer. Do you know how many times people may go through a day, a week, a month, even a year, and never hear anybody pray for them by name? Think about what a powerful ministry it is for someone there in the hospital, laying in the bed with anxiety and worry and fear, to hear their name called by someone else in prayer, lifted up to God's throne of grace, where the Word tells us, His Word tells us, they find His mercy and His help for their time of need. And so a ministry of presence, a ministry of prayer, and then a ministry of permission. We don't show up to do any of this without asking and saying, hey, would it be okay with you if I show up to be there for that surgery, or show up there at the emergency room? And so we want to do everything that we do by permission. Page 64, look at the different types of healthcare ministry that we can expect to be involved with. We want to kind of go through these very quickly, and then we're going to flesh out some of the nuances to each one of them. But number 1, there are 4 major types. Number 1 is a general hospital visit. Now, let me say something very clearly. That's not the television show General Hospital. All right? Now that show has a lot of drama. You know, I can even remember as a kid the Luke and Laura episodes. You know, that's like showing some date, right? You know, I remember I had a sister older and a sister younger, and they were kind of enamored with the Luke and Laura story. And so, but this is a general hospital visit, has absolutely nothing to do with the television show. All right? A general hospital visit is when you go into someone's room either before or after they have just had surgery, or either before or after they've just been admitted. They're out of the emergency room process. They're out of the surgery. They're in the hospital room. You're going in to make a visit. Second type of visit is a surgical visit or an emergency room visit. That is where you've just gotten the news. They're there, or they are going to be going through a 1 hour, a 2 hour, a 3 hour, 4 hour surgery. We want to talk about the things that we should do there. Third, a visit to a nursing home, an assisted living center, a rehab facility, or some other long-term care facility. That's where you know they're there for an extended period of time. It's not just going to be a short few days and they're going to be discharged. So longer-term visit. And then finally, a hospice facility visit And the thing that we'll say about that, they're very similar to the nursing home or assisted living center type visits. But one thing that hospice has become, and it's a great, great organization, great ministry, is that hospice is really focused on long-term pain management, and it's often more associated with end-of-life care issues. And so you're walking into kind of a dual-fold visit there where you're helping someone through a health crisis, but you recognize that it may end up being grief ministry as well as you help a family through a time of loss and a time of growth there as they experience the loss of a loved one. So let's unpack each of those types of visits and look at some basics of what to do when the ministry call comes. Because generally what will happen, you've been building relationships. You're in your neighborhood. You're out walking your dog. You get to know some of your neighbors. Or you have coworkers that you've gotten close to, and you'll get the piece of news that, hey, I've got to have surgery. Would you pray for me? And so, or you'll get the phone call. You've been building that relationship, and they know you, and they're going to call. Here are the things to do when that phone call comes or that word comes, that expression of need and prayer. Number one, seek God's help in prayer, asking God to help you accomplish what He has for you in the ministry situation. You see, we have to start there because hospital ministry can be a skill. It can be things that we can learn, things that we should do and not do. But if we try to do it in our own strength and our own power, we will absolutely fail. And so we always need to be asking for God's strength and His power to help us accomplish what He wants to through us in that situation. Number two, get the facts about what has happened. If you've gotten a call that someone's been in a car accident and they've been transported to the emergency room, you're going to want to know as many facts as you possibly can gather. And so get the facts about what had happened. Take a look at some of the things you'll want to learn. Find out the name, the location, and the phone number of the medical facility. You remember back to that little statement I made earlier about hospital ministry being an interruption? Now, it will be a frustrating interruption if you wind up at the wrong hospital, all right? And so it's real important. You want to get the facts. You want to get the name of the facility because the last thing in the world you want to do is traipse off to the hospital and show up after a 45-minute drive and realize you're at the wrong facility. And so you want to get as much of the facts as you possibly can, the name of where they're going, when things occurred, and what's going on. Number three, obtain the patient's full name as the person would be registered. You see, all too often we go by middle names in our country, or we go by nicknames, and if you show up and you ask to visit one of my son's favorite characters, if you show up and you say, hey, I'm here to visit Bubba Gump, and Bubba Gump's not really Bubba Gump's name. You got Forrest Gump fans? A few. You want to. Bubba Gump's, by the way, the name of the restaurant that they opened. Bubba was just making sure you guys are in with the trivia here. I was trying to mess with you there. But if you show up with a nickname and it's wrong, guess what? The nice person on the other side of that desk, they're not really going to be able to help you with information because there are HIPAA laws, which are Privacy Act laws that will prevent them from divulging any information. So you got to show up with an accurate name, person's full name. Get as much contact information as you can about how to get in touch with the patient or close family members. So if you can get a mobile number, if you can get some type of contact information, you want to get that before you even go. Often, I would encourage you, before going to the medical facility, call and verify that the patient is still there. You may be watching this on video at another part of the country. What I would encourage you to do is get the names of all of the medical facilities in your particular area, hospital telephone numbers, so that when that call comes in, you're prepared. And you've got those in your mobile phone where you can call ahead and get information. Remember, again, we said this earlier, the HIPAA laws will prevent people from giving information to you. And so you want to take a look at some of those issues and factors. Now, take a look at the bottom 4 bullet points, page 65, heading into page 66. Some things that we point out on distinctions between general visits and surgery visits. Bullet point there, talking about surgery visits. What we want to do is when the patient is told to arrive, to be in the waiting room, we want to plan on being there at the time they are scheduled to arrive. Here's how hospital, we've got different time zones in our country, right? We have Eastern Standard Time, we have Central, we have Pacific. And then there's hospital standard time, all right? Let me explain what I mean by that. What that means is that if somebody is scheduled for surgery at 10 a.m., they generally have to arrive at the hospital at 8 a.m. All right? And so what we want to do as a caregiver, as a community chaplain, is someone who wants to step in the gap and minister. We want to show up when the patient is supposed to show up. So if they're scheduled to show up at 8 o'clock, we show up at 8 o'clock because we have the opportunity there to begin to minister, to begin to get to know family members, to begin to get to know names of people, and begin to minister not only to the patient themselves, but to their family members as well. We want to ask permission during that point in time to begin the opportunity of saying, hey, would it be okay when this surgery is over if I make some calls for you? Is there anybody that I could call, anybody that I could let know? Because that is a way of ministry there in the life of that person. We'll flesh that out a little bit more as we go. For an emergency room visit, you're going to want to get there as soon as possible. And when you get there, assess what is needed or what is wanted by the patient or family member, and stay as long as it takes to meet those needs. And say, now, what do you mean by that, Dwayne? Assess what is needed or wanted. Sometimes you'll show up at that emergency room visit, and you will discern, based on signals that they're sending you, that they would really rather be left alone. And what we want to do is we want to meet the person at their point of need. If they need us there, we want to be there. If they're sending the signal that they would rather be left alone, we want to leave them alone. And the emergency room visit may be one of those visits that you're showing up to make without having acquired prior permission to be there. And so what you're doing is you're going to show up and you're going to ask the permission question at that point. Hey, I hope it was okay that I come by. I was just really concerned about you. Is it okay if I step back to see you for a minute? And they will give you some guidance at that point in how they respond on whether you should stay or leave or go, and what their family needs. Now they may be giving you the signal, no, you really don't need to stay. And so you respect what they want and bow out. But that is the time when you can come in and make that visit without prior permission. But as soon as you get there, you want to try to secure permission to kind of stay for a couple of minutes if they're okay with that. General hospital visits, point out something there. The stay is generally very short. This is going to surprise you. About 10 minutes or less gives you the opportunity that you need to pray with the person, to share a verse of encouragement, and to see if there are any other needs or wants that you can possibly meet. You say, why 10 minutes? Why are they in the hospital? They need to do what? They need to rest. They need to be cared for by trained professionals. That's why they're in the hospital. And so the reason we want to keep that hospital visit very short to 10 minutes or less is because we don't want to interrupt what really needs to be taking place there. They really need to be getting proper rest. They really need to be getting the care that they need. And so we're wanting to keep that visit very short, and we're wanting to gain permission at each step of the process. Nursing home or other long-term care visits, a couple things we point out there. Number one, they're not daily type visits. They're less frequent. So maybe once or twice a week. And if it's a longer-term care situation, would strongly encourage you to have a team of people. If you're a part of a small group, if the person that's in the nursing home or in the assisted living facility is there, make it a ministry of your small group because a team of people is much better. Remember a verse of Scripture we shared in the intro. A threefold cord is not quickly broken, right? So we want to be a team. You don't want to carry the burden